Ancient use of the Psalms of David and musical rhythms in healing practices. The use of the Psalms of David in combination with musical rhythms to treat various diseases represents a remarkable synthesis of spirituality, music, and medicine. These practices, rooted in antiquity, demonstrate how faith, word, and art can serve as tools for healing. It is believed that the Psalms of David, which are part of the spiritual heritage, were originally intended not only for prayer, but also for spiritual support in difficult times. Their poetic structure and richness in symbols allowed them to be used as a means of achieving inner balance. In ancient times, many believed that the text of the Psalms had the power to influence the physical and spiritual state of a person. The music that accompanied the reading of the Psalms played an equally important role. Ancient sources often described certain rhythms and melodies that were chosen depending on the type of disease or condition of the patient. This practice was based on the belief that sound vibrations and rhythmic patterns can harmonize body and spirit. The diaries of my ancestors' doctors, who made many expeditions to Jewish shtetls in Ukraine, Poland, and Germany, as the find shows, contain detailed recommendations on the selection and combination of psalms for the treatment of specific ailments. Here are a few examples. A Psalm 31, against the evil eye, against a curse. According to Jewish philosophy, 90% of diseases come from the evil eye, a curse. A Psalm 32, when asking for the mercy of the Almighty, recommended for treatment. The musical rhythm was selected in such a way as to resemble even breathing. A Psalm 141, for pain in the heart, considered healing for the heart and blood circulation. The music for this psalm was rhythmic, but soft, with an emphasis on a stable pulse. Interestingly, the healers also pointed out the need to maintain the correct tempo of reciting the psalms in order to enhance their impact. Music has long been considered a powerful tool for influencing the human body and mind. Rambam and his followers, for example, studied the connection between sounds and the harmony of bodily systems, which later became the basis of music therapy. The healers who used the Psalms of David not only relied on their spiritual power, but also skillfully integrated them into a musical context. The diary's recommendations included the use of various instruments. For example, a kinnor, harp or lyre, to create a soft and calming atmosphere. Flute, to adjust breathing and relieve emotional tension. A drums or tambourines, to stimulate vitality and combat apathy. Each musical accompaniment had its own rhythm, coordinated with the patient's heart rate or breathing, which made the process as harmonious as possible. Interest in the use of spiritual texts and music in medicine continues to this day. Many modern psychologists and music therapists study the influence of rhythm on the human condition. The Psalms of David, due to their universal spiritual significance, continue to inspire researchers. Modern music therapists use similar principles, using specially selected melodies and rhythms to reduce stress, treat depression, and even rehabilitate after physical injuries. Thus, ancient practices live in the context of modern methods of treatment. A feature of Jewish musical works is that many of them were intended for this. The combinations of David's psalms and musical rhythms found in the diaries provide a window into the fascinating world of ancient medicine, where spirituality, art, and science went hand in hand. These practices not only testify to the deep Jewish faith in the power of words and music, but also prove that harmony between body and spirit has always been and remains the most important goal of humanity. The diaries written by my ancestors' doctors are a unique testimony to the rich heritage of Jewish medical and spiritual culture. The diaries, related to travels to Jewish shtetls in Ukraine, Poland, and Germany, open a window to unusual practices that combined medical knowledge and religious traditions. Particular attention in these records is given to the use of psalms to treat various ailments, a technique that can be called a synthesis of spiritual and physical healing. The expeditions organized by my ancestors covered vast areas of Eastern and Western Europe. Jewish shtetls, with their unique cultural and social characteristics, provided physicians with the opportunity not only to study their patients' medical problems but also to engage with their religious beliefs and traditions. These visits took place against the backdrop of the region's complex history, from political change to demographic shifts, making the physician's work especially meaningful. The diaries provide detailed instructions for selecting psalms to treat specific ailments. Each psalm was assigned specific healing properties, which could be related to its text, rhythm, or spiritual meaning. For example, a psalms to relieve anxiety and depression. A psalms recited to treat physical ailments, such as joint pain or fever. A psalm combinations used to provide a holistic approach to treating chronic illnesses. These practices were at the intersection of medicine, spirituality, and psychology, demonstrating the physician's deep understanding of human nature and needs. According to the diaries, the Psalms could be used through a reading aloud by the patient or physician, a meditation on the texts of the Psalms, a writing the Psalms down on paper and placing it near the patient. An important element was the patient's belief in the effectiveness of the method, which indicates the strong role of psychosomatic factors in the healing process. These diaries are not only a medical but also a cultural artifact, demonstrating the close connection between science and spirituality in the past. The practice of using the Psalms to treat ailments reflects a unique approach to health, where physical, emotional, and spiritual well-being were considered as a whole.